best practices,
Trust,
awareness,
community,
treatments,
vaccine,
attitude,
knowledge,
prevention, guidelines.
resolutions. Start by telling the people about your work and what you do.
Yeah, I'm Dagmar Hedrich. I work at the European Monitoring Center for Drug Addiction, collect information on health consequences and on responses to drug-related health consequences.
Do you do a lot of best practice guides from MCDDA? Do you have any about hepatitis C?
Yes, we have actually worked a lot on hepatitis C over the years. We have analyzed, for example, already in 2003, all the national guidelines in the countries, whether drug users were allowed or not to be treated. Then we have published a very extensive literature review, most recently a colleague of mine, and we have also, together with the European Agency for Disease Control and Prevention, we have published very relevant guidelines what countries should be doing to prevent drug-related infections among people who inject drugs.
Have you published a guide and then have seen the effects in that country? Have you seen any results?
The most recent case is Scotland, where a study has shown a reduction of hepatitis prevalence due to the distribution not only of syringes but also of other injecting equipment. Lots of countries have scaled up, and we have analyzed the levels of infection, and we start seeing differences, especially when we analyze whether the countries have provided both syringe exchange and substitution treatment at very high levels. We have a couple of examples where this has been systematically studied, and where the conclusion was that these high levels of prevention have actually reduced the number of cases.
Maybe we can start by you telling me a little bit about yourself. We work in your name.
Sure. Okay, I'm Magdalena Harris. I'm a qualitative sociologist and I'm based at the London School of Hygiene and Tropical Medicine. And I've been doing work around hepatitis C and issues affecting people who inject drugs for a bit over a decade now.
You talked a lot about with attitudes in your talk today about the staff attitude towards the patients and how important that was. Can you elaborate a little bit?
Okay, so I think trust is really important. And I think Chris Ford said it wonderfully today that if she trusts the patient, if she shows her trust in the person that's coming to see her, they will then trust her back, and this is really important. And I see it in my work in regard to provision to methadone. So people who are given access to flexible methadone, they can pick up their methadone once a week, they feel trusted. This is then really great for their self-esteem. You know, then they start to feel much better about themselves. They start to feel, well, maybe, you know, I'm seen as responsible, you know, all that sort of stuff. But people have talked to me in those terms and feel that they can then take on other things like Hep C treatment. Whereas people who are on supervised consumption, they feel like they're not trusted, they get pissed off, they don't want to engage. So, and I mean, stigma is a huge thing. People don't want to go to hospital if they feel they're going to be treated badly there. So if there's an environment where they're treated well and the staff are really warm and receptive and flexible, then they're much more likely to engage.
Maybe we can start by you describing a little bit where you work and what you do in your name.
So my name is Jeff Lazarus. I work at CHIP, which is the Center for Health and Infectious Disease Research at the University of Copenhagen in Denmark.
This conference today that wrapped up was a bit unique because it was the first one on this topic. Can you elaborate a little more?
So this was a conference organized through the Correlation Network. So 3 years ago in Ljubljana in November 2011, there was talk when the Correlation Network's then project ended, shouldn't we do something around HCV? Shouldn't we have an initiative? And funding was received from the European Commission to start a European HCV initiative with a series of what we call work packages. My particular area was organizing a reader, which became a publication, a series of 18 articles on hepatitis C. And this conference is the culmination of all of the different projects that were a part of the HCV initiative run by the Correlation Network. We worked when I was at WHO with EMCDDA on guidelines, and that was around co-infection with HIV. And I think, what you mentioned about guidelines is very interesting because we have a cure now for hepatitis C. We have very effective treatment for hepatitis B. We have a very effective vaccine for hepatitis B. And we have, to varying degrees, resolutions, strategies, action plans, guidelines addressing different aspects of these two often deadly infections. And what we need now is the implementation, the operational research, the implementation research. Why aren't people getting tested? Why aren't people getting treated? Why aren't they getting vaccinated?